Welcome to The Explainer. Today, we're going to dive into the world of hair restoration, and to do that, we're taking a close look at the options offered by one specific clinic, Sanjeevani Cos Derma in Bengaluru. By breaking down their approach, we can get some really great insights into the kinds of solutions that are out there for hair loss.
So if you're struggling with hair loss, you know it's a huge deal for so many people. But finding a real solution can feel, well, overwhelming. So let's just cut through all the noise and really examine the advanced options this clinic is talking about, starting with the main reason people even start looking for help.
Before we jump into all the science and the procedures, the clinic's own materials make a really crucial point. This journey isn't just about hair follicles, it's about confidence. The real goal, the end game, is to feel great in your own skin again.
Okay, so what's the first big solution on the table? Let's start with the surgical option, the hair transplant. This is the one that's presented as a permanent fix for hair loss.
You're going to see this acronym, FUE, everywhere in this field. It just stands for follicular unit extraction. And honestly, the concept is pretty straightforward. It's all about carefully moving individual hair follicles from an area where you have plenty of hair to an area where it's thinning out or bald.
But a standard FUE isn't the only way to do it. What's really interesting here is that they mention more advanced tools and techniques, things like the pen implanter, which suggests a super precise placement for each follicle, or the sapphire technique, which points to using finer, sharper blades for the incisions. Both of these are aimed at one thing, creating a result that looks as natural as possible.
But what if surgery just isn't the route you want to go down? Well, let's look at the second major option they offer, a non-surgical approach called growth factor concentrate, or GFC for short.
And here is the absolute key difference. GFC is totally non-surgical. It uses a super high concentration of growth factors that are taken from your own blood to stimulate the hair follicles you already have. It's like waking them up and giving them a serious boost. So think of it like this. A transplant is like adding new players to the team. GFC, on the other hand, is like putting the players you already have through an elite training program. The goal isn't implantation, it's stimulation. You're trying to reduce hair fall and encourage the hair you have to grow thicker and healthier. This little chart, which comes right from the clinic's FAQ, just lays it all out perfectly. On one side, you've got a surgical procedure aiming for a permanent fix. On the other, you've got a non-surgical treatment designed to stimulate and strengthen what's already there. They're two totally different philosophies, really.
Okay, so the theory sounds good, but what about the actual results? I mean, what are people who've actually done this saying? Let's take a look at some of the patient reviews they shared.
And here we go. Abhishek's feedback takes us right back to that core goal we talked about at the very beginning. After 6 months, he's not just saying the results look amazing, he's talking about how it directly impacted his confidence. That's huge.
Of course, with any kind of surgery, the big question is it going to hurt? Well, Manju's comment tackles that head-on. They describe the pen implanter method as almost painless, with a quick recovery. I mean, that's a really significant piece of the puzzle for anyone considering it.
Wow, now this is a powerful statement about how good the final result can be. Purushottam says that after 6 months, the outcome was so natural that his baldness became, in his words, totally undetectable, even to his friends and colleagues.
And hey, it's not just about the transplants. This feedback from Jiswitha is all about the GFC treatment. She mentions having a good result and seeing a lot of changes, which shows that the non-surgical path can also lead to a really satisfying outcome.
All right, so now that we have a better idea of the options and what real people are saying about the results, let's get into the practical stuff. What are the next steps if you're actually thinking about moving forward?
Let's talk about the big one, cost. It's a major factor for pretty much everyone. So the clinic says they emphasize transparent pricing, so let's see what the numbers they provide look like.
For the surgical hair transplant, the pricing model they show starts at 15 rupees per follicle. So the final cost is obviously going to depend on how many grafts you actually need.
And for the non-surgical GFC treatment, the starting cost is listed at 6,000 rupees. And it's worth noting, the source says this price includes a complete kit for the procedure.
So how does this all kick off? Well, the process is broken down into 3 pretty simple steps. It all starts with scheduling a consultation. That's where you'd get a personalized plan tailored just for you, before you have to commit to anything.
And that brings us full circle, right back to the question we started with. Now that we've seen the 2 main paths, surgical restoration versus non-surgical stimulation, the right choice really comes down to your own personal situation and your goals. The key takeaway here is that whether it's through implantation or invigoration, there are different routes to get to that same destination: confidence.